from Jesse Blanton this morning, who gave us a nice broad overview of rabies prevention and control, and then Dr. Drenzik delved into that a little bit further to give us the nuts and bolts of the rabies risk assessment, et cetera. So what I wanted to try to do today is kind of tie that all in together and just present to you very briefly what resources we have in the state of Georgia and how we approach things here in our state. And then I picked one interesting animal rabies case and our only recent human rabies case, recent being back in 2000, to give you some interesting details about those two cases. So it's always nice to be here at my alma mater. Just wanted to show my support. And again, I wanted to just discuss the Georgia rabies control and notifiable disease statutes that have been previously mentioned, and then describe the rabies prevention and control infrastructure here in Georgia, discuss animal rabies testing here in Georgia, and briefly review the surveillance data, and then again discuss the animal and human rabies case. So Dr. Drenzik mentioned the Georgia rabies law. The statute is OCGA 3119. That's the entire chapter. And I'm certainly not an attorney, and I really have a difficult time interpreting their interesting language, but I tried to include most of the main points that is covered by that law. And namely, one of the big points is that the responsibility for rabies prevention and control is designated to the county boards of health. So we're all Georgians, I'm assuming here. We know that we have 159 counties in Georgia. So it becomes very onerous to try to determine, what county's doing what. So that right there is quite a limitation for us, who work at the state office and try to provide oversight and guidance as needed. So the county boards of health are required to regulate the licensings of animals. And then the law also states that persons bitten by suspect rabid animals are to immediately notify the county board of health, and that owners or custodians of suspect rabid animals are to confine and report to the county board of health. Okay. And that the county boards of health need to promulgate rules and regulations to require vaccinations of cats and dogs. And then lastly, there were a few other points that I just didn't cover that aren't really applicable to this talk today, but this is very important. The county board of health is to appoint a rabies control officer to enforce this code and other laws which regulate the activity of dogs. So what's interesting is that, again, we have 159 counties here in our state, and in most counties, the environmental health specialist is designated as the rabies control officer, which I think is a very positive thing because they receive training in rabies epidemiology, prevention and control. But in some situations, the rabies control officer is actually somebody at the animal control agency, and this happens primarily at the larger metro counties, such as Gwinnett County, DeKalb County, Fulton County. They have the resources to have pretty large animal control enforcement, and in those counties it's typically the animal control agency. And although they do work very closely with their environmental health specialist in the county, they are designated as the rabies control officer. Oops. Is it the top? This one?
This arrows here.
Oh, okay, thanks.
Need to get out of that. Now you can do it.
Okay. So I mentioned the Georgia code that provides for the state rabies law. We also have a Georgia code that requires certain notifiable diseases as reportable. So the Department of Health actually decides which diseases are reportable, but you can see that we have animal bites are reportable, and then rabies, human and animal rabies, is also reportable. So we have sort of, actually two laws that provide for rabies surveillance. So just wanted to talk briefly about the public health infrastructure in our state. As I mentioned, we have 159 counties, so we have 159 county health departments. We have 18 health districts, and the health districts are actually prescribed as a population base. So for example, if you look in the metro area, Fulton County is its own health district because there's so many persons that reside in Fulton County. And not all counties, as I mentioned, have an animal control agency. So just to give you some more details about the prevention and control network in Georgia, at the county level, we have, one of the key staff persons are the environmental health specialist and the environmental health staff. They're the group that's going to typically make prevention and control recommendations, around any potential exposures that occur in their jurisdiction. They're going to be facilitating the testing of animals as needed, and they're going to, generally be the go-to person that's going to be there to assist in any prevention and control activities. We also have local epidemiologists, and there's at least one epidemiologist in every district. So the epidemiologist can help the environmental health person deal with assisting the person if it's recommended for them to receive post-exposure prophylaxis to get that, to be sure that that's done. They can connect with us at the state office if there's some question about whether or not prophy is recommended. And then also the Animal Control Agency, which is resource dependent, and that again is found in some of the larger metropolitan areas and generally not very frequently found in the rural areas of the state. At the state level, we have the epidemiology branch and our acute disease epidemiology section. We have 40 or so epidemiologists that take call on a routine basis, rotating call, and we receive calls from the general public and from district and local partners. Also animal control agencies. We also have our Georgia Public Health Laboratory that does our animal testing for us. This funding to do animal testing is appropriated, so they are set up to do testing. I'll talk a little bit about that a little bit later. And then the Georgia Poison Center is a partner that we contract with, and they assist us in providing rabies risk assessment. They speak to persons from the general public, healthcare providers, and they're very, very helpful in terms of handling the volume of calls that come to us. We also have other partners. Many of them are here in the audience today. The Georgia Department of Agriculture, Animal Health Division, where they issue certificates of veterinary inspection. They're the ones that are going to handle livestock quarantine for us if that needs to happen. Also, we've had some assistance from the livestock inspectors in situations where perhaps we're dealing with a potentially rabid cow or horse, and it's just not very practical for us to, have a veterinarian, remove the head and then send it. Usually the heads are sent via mail. Obviously that's not practical if it's a cow or a horse. And so then there's the logistic issue of how do we get that animal's head or brain to the appropriate laboratory, and most often they'll go to the veterinary diagnostic lab because they have to remove the brain, and the Georgia Public Health Laboratory does not have the equipment to do that. So livestock inspectors have been really instrumental in helping us get that large animal head to the diagnostic laboratory. Again, the College of Veterinary Medicine, Veterinary Diagnostic Laboratory, they have been helpful in terms of removing, the brains of some of these larger animals, and they perform testing, and then it's sent to the Public Health Laboratory for confirmation. They also will provide testing for diagnostic purposes. And then I didn't want to overlook USDA, our Wildlife Service partners that administer the oral rabies program. We have our APHIS partners that also work with us, and then SQUIDIS, the Southeast Cooperative Wildlife Disease Study, and then also law enforcement. That plays a real key role in Georgia. in transporting large animal heads to the diagnostic laboratory. We've had Georgia State Patrol officers that have volunteered before. They usually perform like a relay. They take it, through their district and meet another State Patrol officer, and they just relay all the way to the diagnostic laboratory. So they're real key. Also, sheriff's departments in some counties that don't have animal control, we require or rely on them really to assist us with doing follow-ups to be sure that pets are being quarantined if it's been recommended to do so. So they play a key role as well. So as far as rabies risk assessment goes, I know Dr. Drenzik, discussed specifically what is done and how it's conducted, but who does that in the state? Again, it's the county and district environmental health staff, sometimes animal control officers, the local epidemiologists, and then epidemiologists at the state. So our rabies epidemiologist, myself, Dr. Drenzik, we have an EIS officer who's a veterinarian, and also the Georgia Poison Control Center. The Georgia Poison Control Center, as I mentioned, receives calls from healthcare providers, the public, and animal control officers. They provide risk assessments for us. They make recommendations for prophylaxis if needed, if indicated. We do train them. They are using approved resources such as our Georgia Rabies Control Manual and the Rabies Compendium. So they're a real helpful piece to the puzzle. There'd just be no way that we could handle the volume of calls, especially after hours and on the weekends. So just wanted to talk a little bit about animal rabies surveillance. And I think what I kind of wanted to emphasize, this is generally, we do have an issue with the general public not really understanding what rabies surveillance is in Georgia and what it's not. So this is really geared towards that. I think everyone here in this room knows what we do with surveillance, but it's really to inform prevention and control recommendations. We know that rabies is endemic here, and I have to emphasize over and over and over, especially with the media, that it's not to determine what the incidence or prevalence of rabies is in our state. It is helpful to identify hotspots and to raise awareness, I think, but what we often see is that if one animal tests positive, there's just a panic in the community. So we do a lot of education, and try to infer to people that it's here, and the take-home messages are you need to be sure that your pets are vaccinated. You need to avoid contact with wildlife whenever possible. So just a reminder for general public and media, and as I was pulling images off the internet last night, my 10-year-old son leaned over my shoulder. He's like, wow, this is really cool. He said, too bad you couldn't find a rabid honey badger. Okay, so animal rabies testing in Georgia. Public health provides testing when a potential exposure occurs, and generally it's a human exposure, but we do test animals that have potentially exposed a domestic animal. We have limited resources, so we try to be very judicious with that resource when it comes to testing for potentially domestic animals being exposed, and preferably after a risk assessment is conducted. Again, it's primarily wildlife that we're testing, but it does include domestic animals who have bitten humans. And in most all cases, we really try to encourage animal control officials, if at all possible, if they have the animal to observe the animal for the 10-day period. It does cost about $140 perhaps per animal test that we conduct. And we do 2,000, 3,000, maybe 3,500 animals per year. And so that can get very costly, over a period of, several years. And then again, testing to inform a public health action. So if we have a situation where a currently vaccinated domestic animal has had an encounter with a raccoon, and it's possible, likely, that raccoon has rabies, if it's not really going to change what we recommend to do, we're going to recommend that dog be boosted. But we don't necessarily need to, have a very strict 6-month quarantine period. We might say, that's an animal that, we may not necessarily have to test. And then again, the diagnostic lab for diagnostic purposes, when a veterinary clinician is seeing an animal with a neurological disease that hasn't exposed anybody on their staff and they just want, a diagnosis. We won't provide testing for those situations. So here's just the top number of species that we've tested for the last 3 years in terms of positive results. So you can see the usual suspects are up at the top: raccoon, skunks, and foxes. And we do submit a very few number of samples to CDC on an annual basis for rabies virus variant speciation or confirmation, and most of all of it is of course going to be southeastern raccoon species. You can see cats are up there on the list, and then we have our occasional large animal. Those can be very interesting. They typically will have more of what we call dumb rabies, and often those are associated with a lot of exposures because we have people either trying to feed them or they're doing oral exams because the cows or horses may be salivating. So even though there's only a few of them, they generally are associated with a large number of exposures. So this chart just shows just a sample of animals that were tested in 2012. And just to bring to your attention, so we tested, you can see at the top line, 373 bats, 27 were positive, 3 bobcats, they were all positive. But if you look at cats and dogs, you can see we test a large number of cats and dogs, but only a small proportion of them are positive. And it may raise a red flag for us in terms of management. Why are so many cats and dogs submitted? Certainly it's appropriate if the cats and dogs died after biting the human, but we try to always encourage animal control officers to to observe the cat or dog for 10 days rather than using public health dollars to go ahead and test them. So I wanted to shift focus a little bit and we'll talk about the interesting animal case. This was an investigation that Dr. Drenzik led back in May of 2001 when she was serving as the state public health veterinarian. So there was a rabid goat at the Georgia Agri-Rama. So I don't know if anyone's visited the Agri-Rama, but it's essentially an agriculture museum, and they talk about farming. There are lots of school field trips that make this trip. It's located in Tifton, Georgia. And on May 2nd, a 17-week-old male goat housed there was a donation from somebody local in the area. Was found to be in lateral recumbency and wouldn't eat. He was evaluated at a local veterinary clinic. The physical exam revealed the animal to be non-ambulatory, mildly obtunded, and distressed. So he was transferred to the regional veterinary diagnostic laboratory and was euthanized. Head was submitted to the public health lab there for rabies testing, and the diagnosis of rabies was made the following day. The virus variant was determined to be southeastern raccoon. So you can imagine it was quite a large response. Here we have a facility that housed a rabid animal that is open to the public, and we're seeing field trips and a large number of people coming through this facility. So it did result in a large public health response. One of the first things that was done was that public health education was provided. There were press releases that were conducted. Then a transmission period, risk period was established, and that was determined to be 2 weeks prior to the onset, which would have been April 20th to May 4th. identified potentially exposed individuals through visitor logs, field trip lists, press releases. And one thing I wanted to note is, we talked about, Jesse mentioned poor journalism. At the time, there had been communication with the local media there, and they had written something up in their local paper, the Tifton Gazette, and they were talking about rabies and the rabid goat and how rabies is 100% fatal. And this is a quote: "Rabies is 100% preventable by simply fascinating your animals." Rather than, must have not heard vaccinating. So that was actually published in the Tifton Gazette. So then standardized exposure risk assessments were developed and conducted. So that would be something very similar to what we do with an outbreak case definition. So if you were at the agrorama between X date and X date, and you had contact with the goat, and you had your fingers in their mouth, so it was very standardized with the emphasis to try to catch the people that needed to be catch, and conduct further risk assessments and exclude the people that we didn't need to directly address. So then the need for post-exposure prophylaxis was evaluated for those that were considered to be high risk, and then you can imagine the logistics in coordinating post-exposure prophylaxis for a large number of people. In Georgia, usually PEP is administered through the private sector, but just logistically it would be really difficult to try to coordinate that for a large number of people. So they employed these variety of methods. The health district there actually purchased rabies biologics, and they administered PEP at some of their clinics. Some of the local hospitals participated in assisting, and other persons that resided in other health districts. We even had people from the metro Atlanta area that were down there, were referred to local physicians or the emergency departments in their area. So all in all, a total of 339 people were prophylaxed at sort of an estimated cost of $415,279. So a big effort. So now I wanted to just share with you our last human rabies case in Georgia, which was in the year 2000. It was a 26-year-old male from Taylor County. He was presented actually to his healthcare provider on the 3rd for intractable vomiting. He was treated with an antiemetic, sent home. He presented the same night because he continued to vomit. He was admitted with fever, respiratory depression, and confusion. He was transferred to the regional hospital a couple days later, progressively got worse, required mechanical ventilation, and then developed cardiac arrhythmias and respiratory failure on the 10th and subsequently died. So the diagnosis was made post-mortem at CDC. It was determined to be bat virus variant, Mexican free-tail bat. And what the investigation revealed, this was another one that Dr. Drenzik got to do. The patient had lived in this house, and I've got a picture of it to share with you, for 3 months. And there was a colony of bats living in the attic. And anecdotally, the patient had reported to friends on several nights he had awakened and actually sort of had to kick bats off his feet, and just did not appreciate that there was a risk of rabies in this situation. So he didn't seek PEP and just didn't appreciate the risk. So this is the house, and I don't know. Oh, okay. And then you can see it's an older house, and this is typically the kind of house that we see with bat colonies, just because of the there's access up under the roof where the bats can get in. And so this was all determined, after the patient had already died, unfortunately. So just some resources. I think this has been displayed before. Happy if you want any of these resources to just leave your name and I can email them. Melissa Ivy said she'd be happy. She's got some hard copies of our Georgia Rabies Control Manual. We can share that with you. And that's it. That's all I have. You may have heard about this. Any questions?
We have one.
How many of the positive cats and dogs that you got from rabies had been vaccinated against rabies?
Yeah, probably 0. And do we probably didn't even capture that information at that time.
I'm not sure how,
I mean-
at least for the past several years that's been captured, but I can't recall any instance in which there's been a positive dog or cat that was current on vaccination.
Well, if
Someone
you
like
knew
hasn't-
not even current, just had ever been vaccinated.
Okay. Why we have time for more questions if they're short. Okay, go ahead.
So, is it possible to get your database, or when you test a wild animal, whether it's positive or negative, at a finer resolution than at just the county level? Is it
Well, so
get that reported in a day so that
animal bite reporting is just very onerous, and it comes from many different sources, and we've attempted to improve that surveillance through developing an electronic module, a web-based module that Melissa's going to speak about in the next talk. So maybe that might clarify or prompt you to ask further questions.
we would certainly help with some research?
Yeah.
Yeah, and I guess the other thing too, I just wanted to mention, take home message, animal bite surveillance and animal rabies testing, really is probably just, it's a factor of, wildlife encounters. For whatever reason, people are coming into contact or domestic animals are coming into contact, with wildlife, and whether that is because of, building in the area, we don't know. We can't capture that data, but it's a very difficult surveillance to undertake, to be able to determine all of the pieces.
Okay. Dr. Zhao, you had a question?
Yeah, I just had a question. Since you spent $450,000 on post-exposure, any consideration in talking to the state veterinarian about making rabies immunization a requirement for show animals, or just paying for that yourselves, since we could have probably vaccinated everything in the next
Right. So
2 or 3 years?
Sherry can chime in, but I believe that it was determined that it was some insurance that the Agri-Rama had that ended up ultimately covering the bill for that. But I think they had to determine that they weren't negligent, or there was some sort of legal investigation around that. So luckily, public health didn't have to pay for it because we don't have that kind of money.
I think we need to have a rebuttal over there. Yes, sir.
If you have animals that are vaccinated extra label, that aren't listed as on the vaccine label as being covered by this vaccine in these petting zoos and whatnot, how are you dealing with that?
Well, that's your job, isn't it?
Yeah.
Yeah, I mean, that question, Dr. Crane posed a question similar to that earlier, in that, if you have a wolf hybrid that's, vaccinated and it bites a human, are you going to consider that dog vaccinated? But we have to remember that we're going to observe a dog or a wolf hybrid or an animal, if possible, for the 10-day period, to see whether or not they develop, any clinical illness. And if they do, then we test them. So it's not really a concern so much when that vaccinated animal or off-label vaccinated animal bites a human. It's more of a concern when that animal who's vaccinated off-label encounters, an observed encounter with wildlife. And then we're like, well, now what do we do? Is it a 6-month quarantine? Do we recommend euthanasia? What do we do? So I think that's a challenge. But yeah, it's a great question.